If your eyes look heavier than they used to, the natural assumption is excess eyelid skin. Sometimes that's correct, but very often what you're seeing is influenced by brow position. As the brow gradually lowers with time, it pushes skin onto the upper eyelid, creating a heavier appearance. What this can point to is not just an eyelid issue, but sometimes a brow component as well. This is why some people benefit from upper eyelid surgery alone, while others also need a brow support to be addressed. And it's also why self-diagnosis here can be misleading. Observation 2. I look tired even when I'm not. Many people notice they look tired despite feeling well rested. This is usually not about fatigue. It's often related to changes in the upper and eyelid contour and support. As structures change, for instance, in the upper eyelid, ptosis can occur. Patients can have a droopy eyelid and resulting in them looking tired all the time despite feeling rested, despite sleeping almost 8 hours a night. And ptosis repair is something that can be addressed surgically, both at the same time with an upper eyelid blepharoplasty or by itself, for instance. As structures beneath the eye shift over time, light and shadows change, which can create a tired appearance in the lower eyelids. In some cases, this points toward volume or support changes rather than excess skin. That's why treatments for the lower eyelid can vary widely when it comes to lower eyelid blepharoplasty techniques to address the fat prominence and fat repositioning, with fat grafting for the mid-face for volume support, with or without addressing the removal of skin versus skin resurfacing. So a lot of combination of procedures that can be done to address lower eyelid aging, which is why I love doing this procedure. It's so customized for what the person or my patient presents with. Observation 3, one eye looks different from the other. Noticing asymmetry is very common. One eye may look more open. One side may look heavier. Faces are naturally asymmetric and they have always been that way. So what often changes is that asymmetry becomes more noticeable over time. This can point to differences in brow position, eyelid support, or muscle activity. Trying to correct asymmetry without understanding its cause often leads to overcorrection. This is where careful examination matters more than chasing balance. Observation 4, my eyes look different depending on the day. Some days the eyes look more open, other days the eyes look heavier or more tired. This variability is normal. It's influenced by sleep, hydration, what we eat, inflammation, and muscle tone. What this often tells us is that the face is dynamic. There's always changes. This is one of the reasons why decisions based on a single mirror moment don't age well. Patterns matter more than snapshots. And so that's why I take into effect looking at patients' photos when they were younger to see how they've aged, to evaluating them in my examination process while they're resting, for instance, while they're smiling, while they're looking at different gazes. So I can assess how the patients are with different sort of presentations, and that way I can lead to a recommendation, based on the anatomy and not just an immediate observation. Heavier eyes don't always mean eyelid surgery. A tired look doesn't always mean volume. Asymmetry doesn't always need correction. This is why professional assessment is important. It allows us to understand what's actually causing what you're seeing, and whether you do nothing, waiting, or intervening makes the most sense. Most things people notice in the mirror aren't problems, they're information, and that information only becomes useful when it's interpreted correctly. If this helped you understand what you might be noticing and why assessment matters, please subscribe. This channel is about helping people understand facial changes clearly so decisions are thoughtful and not rushed. And if you'd like to go deeper, watch the next video. Understanding the why always comes before deciding the what.